Good morning and a warm welcome, everyone, for joining us today from across Europe and beyond. My name is Mira. I work for NEMO, and I'm delighted to have you all here today with us for this webinar, which is part of our ongoing activities and also our exploration of how museums can contribute to well-being. Hospital room service for art, bringing art into patient care, is facilitated today by Professor Dr. Tessa Kerre, a hematologist at Ghent University Hospital and a passionate advocate for integrating art into healthcare. Her work, ranging from art on prescription to shared reading programs for cancer patients, offers powerful insights into how cultural experiences can support healing and human connection. Her perspective is especially relevant as we look ahead to our NEMO's European Museum Conference in a few weeks in Denmark, where we'll dive deeper into the topic, Who Cares? Museums, Wellbeing and Resilience. Tessa will speak for about 40 to 50 minutes, and at the end we'll have time for a few questions. Feel free to drop your questions in the chat function as we go. So let's get started. Tessa, I hand over to you. The floor is yours.
Thanks a lot, Mira, for the very nice introduction. So good morning, everybody. Thanks for being here. I cannot see you, but I see all the names popping up. So I'm very happy that so many people decided to join on this Monday morning, and I'm happy to share my views on art on prescription, and especially make a plea for integrating art in care. So I'm a hematologist. I'm a professor in hematology at Ghent University, and I'm head of the Department of Hematology in the Ghent University Hospital. So I have been treating for more than 20 years patients with blood diseases, and I'm specialized in acute leukemia, so a very aggressive form of blood cancer, stem cell transplantation, and immunotherapy. So I'm really treating patients who are really very sick, and usually also for a long time admitted in the hospital, sometimes for weeks in a row. They are in their beds, they are in isolation, so they cannot leave the room unless it's really necessary for their health, to undergo examinations or things like that. But otherwise, they stay in their room, and only a few people can enter. They have to wear masks. So it's like they are in COVID times, but for a long time. And usually they are admitted for several weeks, sometimes even months. Then they can go home for like 1 or 2 weeks, and then they have to be admitted again for several weeks. And for example, for stem cell transplantation, they usually are admitted for 6 to 8 weeks in a row. So it's really very heavy. I see that their life is really reduced to that small room. They lose autonomy because they cannot decide who comes into the room. Nurses, doctors, psychologists, dietitians, physical therapists, they enter when it's part of their scheme to enter that room, and not because the patient asks to be that person to enter the room. So it's really a very sad period, but despite all the misery and the sadness, and their life being at stake, because we lose a lot of patients die also at our department, unfortunately. We also are a very warm department, and we take care of patients from human to human. And I'm convinced that the arts are an important part of that, in connecting people, like people taking care of patients, and the patients and their personal caregivers, so their next of kin themselves. And I want to talk to you today about that, about how I suddenly had a dream to bring art at the bedside. So I came to that dream and to that project, but also I will give you some examples of how we are doing it here at the Ghent University Hospital. So first of all, one of the reasons why I came up with this project was that I'm worrying a bit about the care we give to our patients. Not so much in our own department, but in general. And I also see it happening in our own department, in our own hospital. I don't know if you also have these in the museum. I'm sure it also has entered there. It's the checklist phenomenon. So the quality systems, we have to make sure we are giving quality care and quality, we do things in life and in our work that are of high quality, and that's really important. And I'm sure that checklists can help. And I've set up a quality system in my own hospital briefly after I started, so almost 20 years ago, on stem cell transplantation. And I'm really convinced that this quality system has improved our care. But I also am a bit worried that by leaving it all to checklists, that one of the ticks in the checklist, and for me, it's the most important one, that spending time with the patient from person to person, that's not on the checklist. And also with the digitalization of the care in hospitals and beyond the hospital setting, has not helped this. We hoped that by digitalizing, by having computers to help us in our daily care, we could focus more on the reason why we chose to become a healthcare care professional, and that is spending time with the patient. But unfortunately, what I see is that we spend more and more time in front of our computers, bringing in the notes, and I hear it a lot from colleagues, doctors, nurses, other healthcare professionals, that they say we spend more time in front of a screen than on the bed of the people. And that's why we chose this job. So this is something that worries me. And I want to give an example of that. So I don't know if you know that in your countries, but it's these are little book cards. So cards full of books. And I always call them like angel-like creatures that push them through the corridors and into the rooms of the patients. And I always was very happy when I saw them passing by. I was like, oh, they're bringing all these stories in the rooms of patients who are admitted, who are suffering, and they bring a little bit of light. But a few years ago, I stopped seeing them in the corridors. And at first I thought, well, it's a coincidence. They're not always there. You just have to be at the same time, at the same place. So it's possible that it just happens rarely. But at a certain point, I was like, I've never seen them in like 1 year or so. That's strange. So I inquired, and the answer I got was really sad, I think. It was that indeed they are not there anymore. We stopped the collaboration with the Red Cross, because it's a Red Cross that sent those book cards with the angel-like people pushing them. And the reason why was, first of all, they thought that maybe it was not so hygienic to have these books transferred from room to room. And the second reason was that probably everybody right now has a digital reader, and they read from a digital reader, so they don't need books on paper. And I strongly disagree with both of them. First of all, I've never heard of somebody who died from an infection because they rent a book from a library. This is what we do. And so that was not a good reason. And the second, not everybody has a digital reader. Not everybody even has books or can lend books. So we need those book cards back, and I'm trying to get them back, and even trying to get another card, an art card, but I'm come back to that later in my talk, into the hospital. So for me, that's kind of a symptom of the disease I was just discussing, the checklist disease. We see this book card. Are they really important? Are they possibly dangerous? Can we check off the list that they are hygienic? Maybe not, so we just leave them out. And you lose something very valuable in taking care of the people, not the diseases, but the people who are admitted in the hospital. So this brings me to the first big project I did already more than 5 years ago in Ghent, and that was the Ghent Shared Reading Project. But first, I have to tell you about how it all started. And it was on a very rainy, cold evening in Ghent in November 2019. And as you can see, the auditorium was really packed with students. We had more than 400 students there. And as you can also see, they are not looking at their phones. They are really paying attention. They are looking at the person who is in front of the room. And that person was Jane Davis. And I don't know if you know her. If you don't, please check her out. She's a wonderful person. She's one of my heroes, and I'm very happy. I will again meet her in person in May, because I can go on a trip to the project, the place where it all started. And Jane Davis, let me first start with telling her story. She's, as a child, she was born in Liverpool. She's still stationed there and lives there. And she was born in a very poor family. Her father quickly disappeared out of the picture. Her mother was severely addicted to alcohol. Yeah, like it sometimes is with these families, as the child grows up in this situation, they are almost bound to become addicts themselves and also stay in the misery. But little Jane escaped from the misery, because right just across the corner there was a library. And she went to that library, she rented books, she read books. And in this way, she kind of pulled herself out of the misery. And she studied at university, literature, and she became a literature professor at the Liverpool University for 10 years. And after 10 years, she said, I have the impression that after 10 years being a professor at university, I did not do for people and for society with my job what literature did for me. The importance, it really saved me. Literature saved me. And I wanted to do it to give something back to the society. But I don't have the impression of the feeling that I could have done, that I did that during the past years. So what did she do? One of the things she studied while she were a university professor, and one of the new kind of methods she developed, was the shared reading. And using this method, she founded The Reader. And The Reader is a non-profit organization that brings this shared reading to people in vulnerable situations, like in retirement homes, in prison, for people in poverty. And what is shared reading? You read together. Usually, it's in a group, so with several people, a small group, like 10 to 15 people. There's always somebody who leads the group, and then you read together a text, a short story, or a part of a longer story, or a poem. And at certain times within the reading, you read aloud, and at certain times you pause in the text. And after the pause, you reflect on what you just read. And it brings up all kinds of interpretations, because I don't know if anybody of you have ever already done it, but if not, please do. It's so enriching, because you see that when you read a book, when you read a poem, a short story, with 10, 15 people, everybody reads it in a different way, because the way you read things and you interpret things and your imagination goes like all the way. It is based on what you have, your memories, what you have experienced in life. Depending on that, you color the story you read in a totally different way. And it can also awaken emotions that can be totally different. The same text can bring a certain person to tears because they think about something that was really emotional, a memory. It can make other people like angry, was like, what is he saying? No, he or she shouldn't do that. It's no. So it's incredible how it enriches the way you read texts in an incredible way. But it also goes deep into people's lives. And it brings back memories. You share these memories because you reflect on the text. And if you want to, you can share everything you want. And it starts a conversation and it starts a connection. And it's in a really safe way because you always can get back to the text. If you feel like, oh, this is getting really deep into my life and I'm not ready to share something about it, you can just listen to other people, or you can go back to the text and say, let's read further into the text. Or you can decide, because usually those groups are such safe spaces and places that what I witnessed is that people, they talk about things they've never shared with anybody else. So it's incredible what this shared reading can do. So what Jane did, she founded this organization. She herself went to several places. I mean, I can talk 1 hour about what Jane talked about that evening in November in 2019. The story she told, it was amazing. But it's not possible because I also have to talk about my own project. But she supported several people to know this shared reading process, and she sent them out to retirement homes, to people in poverty, to prisons, and they started reading together. And all over the world, probably all over the countries you are from, you have kind of a sister organization that is coupled to the reader or was inspired by the reader. And in Flanders, that is this one, Het Lezerscollectief, for Flanders and the Netherlands. It's a wonderful organization. And it has been my partner for all of the projects I will talk to you, considering reading, of course, not on all other art projects. So for this, so this is Jane again in front of the auditorium, and we invited her because we wanted to start with a project, a new product, like a research project. And we used her as kind of an inspirator to try to find students of our faculty that would be in their later life, when they were finished their education, they would be in contact with patients. So not only doctors, there were a lot of doctors there in training, but also physical therapists, also audiologists. So all these people that would be in their later life become somebody who had contact with patients. After that, we asked them, I came after Jane, and I said, we have a special project that will start in a few months, and we want to do this shared reading, but not in a group, but in a one-on-one setting. And one of them will be one of you, a student, and the other one will be a patient, a person treated for cancer in our hospital. We would need 20 students. We will look for 20 patients who want to do that. And then the 20 students will be educated in a 3-day session, also with sleepovers. So it's really a very intense course by Het Lezerscollectief, so the Flemish, the reader. And afterwards, you will be connected to a person with cancer, and you will read together for 50 minutes to 1 hour, 8 to 10 times, and we will study this. We will study the effects on you as a student, but as a future professional in healthcare, and we will study the effects on the patients. So we got more than 80 students who were interested. The letters we got was the motivational letters. They were unbelievable. It was heartbreaking that we had to select only 20 out of the 80 and send a letter to 60 of them, like, you were not chosen, we're very sorry, but we had to choose. We had only budget for 20 students. But what they wrote down there was one student who said, it's been like years and years since I wrote a novel, since I read a novel. But now, after listening to Jane Davis, I will start reading this evening. So it was amazing what the personal stories they shared already in their motivational letters. But we got this group of 20 people. We found 20 patients. It was not easy. I thought, such a beautiful project. People will, we will say, no, sorry, we're full, we're fully booked. But no, it took us, I think it was about 43 people before we got our 20 patients. Reasons were that they were not comfortable. What is it? Reading. So a person coming into my room reading. I can read myself. Nobody has to read me aloud. I can do it myself. So kind of the autonomy that they were thinking that we were taking away another part of their autonomy, and we had been taken away already a lot of it, while it was giving them something back. But people didn't know that, of course. They were a little bit afraid. They are, of course, in a very heavy trajectory. It's very heavy, what they are going through. And they were like, oh, but maybe I don't feel well. And then I have to tell this person that they cannot come. And they were worried about it. We said, don't worry about it. We will take care of that. It's no problem. The students know that you're in a very heavy process and that you might be too sick. You don't have to worry. But still, it took us a while before we found the 20 patients. But we found them. We coupled them with the students. And then I told you it was November 19. So we were already beginning of 2020. And then, as you all know, the little virus came called the SARS-CoV. And we had the COVID pandemic. So we already started with the project, but it was a one-of-one project. So the students came into the room of the patients. So for a period of time, they were not allowed to come, of course. People had to choose. They had, at some point, they could not have any people visiting them. And at a certain time, then they had to choose one. So of course they didn't choose the person, although we had one patient who said, like, I really wanted to choose him, but I think my husband would be mad with me when I chose the student coming to read with me instead of him sitting by my bedside. That was a bit funny. But of course it had impact on the study. Of course, some patients after COVID, they were not in an actual active treatment anymore, which was a good reason to stop the study. Other patients unfortunately died. We had 6 patients who died from the 20, which was of course a very sad reason that the study stopped. We also had some students that were now in another hospital, in another university, because they're doing their internships. In total, we had about only 8 couples that finished the whole process. But what we learned from that was amazing. I cannot tell you how impressive it was, how the 2 people connected. I had, for example, one lady, she was one of my patients, and she was admitted when we were recruiting patients for the project. And at first we thought she had acute leukemia, and she had a transplant 3 years before, and we thought the leukemia was gone, and she was admitted for some stomach problems, and we thought it's like an infectious problem. We give her antibiotics and everything will be okay again. But unfortunately, it became clear that it was her disease. Her leukemia came back in her stomach, which is very rare. We tried to treat it, but we failed. And after a few weeks, she was already in the shared reading study. It became clear that she would not make it, and she would die in a few weeks. So we had a meeting with her and with the student that was reading together with her. And we said, okay, we understand that this is not a priority right now for you, not for the patient, because it was the last weeks of her life. And the student, yeah, it was not easy. It was like a 23-year-old young guy, a wonderful person studying medicine. They had really connected together, and now his companion, his reading companion, would die. But both of them said like, oh, if the other one wants, if she wants it, the male student said, I really want to keep on reading for her. And she said, if he still wants it, I really want him to come. And he's one of the rare people that I still want in my room, but I really want him there. And what we do together, he read me a short story on a very romantic story. And I was thinking about when I met my husband. It's like 30 years ago. She was about 55 years old, something like that. And she said, how wonderful it is that I remember now so vividly because of that poem, because of that text. I remember so vividly those beautiful moments when I just met my husband. It was incredible what we saw there. So it made me think that I could not stop with just this project, and I had to go on. And at the time we started, the evidence on shared reading, and especially in cancer patients, was not big. So there was not a big amount of literature, but since then the amount of literature has grown immensely. And for example, this is, if you are interested, this is a very interesting study on the evidence of shared reading in group. So we still did not find any other evidence than our project in a one-on-one setting. But also a lot of the results of the conclusions of the study in reading in group with people with cancer is also the safety of this group, the fact that they share things they have never shared before, or only with their really very close, like their partner or their children, but even not them. And it allowed them to be able to share it with people they did not know before. It allowed them to also talk about it with their people that were very close to them. And also the resilience, so the remindings that you see, like here, like it's a gulf from the sea that goes on and on and on. It's not only the time you spend together reading the text and talking about it. It goes so deep that you remind weeks later, and even sometimes months later, you are reminded of you remember part of that talk. So I'm talking to you about you come from museums, so you already have a heart for arts, and undoubtedly lots of people already also read books and are convinced of the power of literature and poems. And but of course I have to convince people that believe in hardcore science, and they say, yeah, Tessa, your research project is qualitative research. It's only a small group of people. Are you sure that this really means something? So those people, you don't convince them with stories and with qualitative research, while it is really very important and worthwhile research. You need those kind of people. They need squares, and they need I don't know the English word, like what you see here. um, they need that. And this is a study I always talk to them about. It's a study that was done and published in PNAS, which is like a really big paper in science. And what they did was they studied children who were just after surgery, and they had pain. They were in pain, and they studied the pre and the post. I don't know if you can see my arrow here. So the pre and the post, and in intervention. And what was the intervention? The intervention was, or they did a riddle. So they kind of, did a riddle with the children, or they read a story together. And what they evaluated, the first one is the oxytocin in the saliva of the children. So oxytocin you could call like the happiness hormone. The cortisol you can call the stress hormone. And this part is on like a questionnaire on pain scores but especially validated for children. And what you can see here is after the intervention, they did not get any other treatment or painkiller or nothing. And you see that the happiness hormone goes up, the stress hormone goes down, and also the pain level with the questionnaire goes down. And that's not all. When you compare the effects of both the riddle and the storytelling has a significantly higher impact than the riddle. So that's amazing to see here. So that's a paper that I use to also convince people that needs graphics to be convinced, and hardcore science. Now, I told you about the fact that we had the reading project together in COVID times. And of course, the students that were selected, they were like, I don't know, wonderful people, or wonderful group of people. We also came together frequently, because when they read to patients and what happened to the patients, it was quite heavy. So we came together every few weeks and we talked about it. And also in COVID times, we had done the online Teams meetings like we have now, but interactive. And we talked about, okay, what can we do to keep this project alive? Because I wanted to do something for the patients. And some of the things we talked about was we should have like a box in the hospital with stories, and then they can read it. They can take a story or a poem and they can read together with the people who are visiting them, or the person who is visiting them. Of course, at that time, that was not possible, because if you remember, in COVID times, you could not have your hands in the same box, so it has to be separated. So what they did at that time, they made like small boxes. We call them reading pralines, and they were first in quarantine, and then after 2 weeks, the nurses brought them to the rooms of the patients. But afterwards, we still got this, like after COVID, or when the COVID we're still in COVID, but after COVID was the really intense COVID period. One of the students, and you see her here in the middle picture, Astrid Ali, she made, together with her father in the summer, the first COVID summer, she made that box. And it's kind of a reading mailbox. So below, you can see it's a little, you can put your hand there and take something out. And what is there? That's the reading pralines. So they're all little poems and texts. And sometimes they are, they also have something that is like, for example, it's a little poem called Snow by Bart Moejaert. It's one of the famous Flemish artists and poets, and also he writes books for children. And he has won a few years ago the Astrid Lindgren Award. So those from the North probably know that very well. So we're very proud of that. So Bart, one of his poems, Snow, was or also he has a poem Spoon, and it was attached, this poem, to a little spoon, for example. So it's like little pieces of art there, and you can take one out. And in the upper, so I always call it the attic of the reading mailbox, that's Astrid put some Playmobil gadgets there. So, and you had the, as you can see in the middle, you could you had peeping holes, and you could look inside and see what was there. It was beautiful. But after several years, I was like, I'm doing all this art projects, and I want kind of upgrade of this box on top of the reading box. And then we had a transformation, and it now is, as you can see here, it's the smallest museum in the world. So I definitely wanted to show you that, because you're all from museum backgrounds. So I don't know exactly if they are smaller museums than it, but it's really, really small. So as you can see here, it's you cannot see it, but it's like it's like this small. The box this small. So it's a really, really small museum. And the first exhibition was opened in June this year, and in December we will have the next one. And in now it's an exhibition, a very touching one, from Saar de Buissere. It's an artist that works in collaboration with a very special project also. It's called Post Office 000000, and it's a post office you can send letters to people who have passed away, who are dead, but you want to talk to them, and you send those letters, and you get a piece of art back, accompanied by a part of your letter that inspired the artist to make this piece of art. And Sarah was one of the first artists collaborating with this Post Office 00. And she makes, as you can see, I don't know if it's clear, but if I tell you, you will probably say, yeah, I see it. She makes little pieces of art on stamps. So really, really small pieces of art. So they were perfect for the smallest museum in the world. So yeah, it's now back here in the hospital. It hangs here and at our department. And people can, it has a little light, which is very nice. So you can put on the light and then you can look inside and look at all the pieces of art that are exhibited in the smallest museum in the world. So always welcome to visit us in Ghent in our hospital. And I also have amazing news because in the next few weeks, so in mid-October till end October, we have at the Ghent University Museum, also very nice museum. If you ever come to Ghent, we have beautiful museums. This is the Museum of Doubt. So a science museum, and they have the dark weekends, and the theme of the dark weekends, for example, last year it was on occult sciences, and now the theme is sorrow. And they asked me if my smallest museum, because yeah, it's on sorrow, of course, the current exhibition, could travel to the big museum, the GUM, and it can be there. So I was very excited. And I'm now contacted poets to deliver a poem, especially for that occasion. So the box below, when it is in the museum, will be the sports museum in the big museum. It will be full of reading pralines from great Flemish poets. So it's so wonderful. I'm really happy that we can spread, and we even now have an identical copy made because I want to, the smallest museum in the world, I want to have several of them in the hospital, and it would be my dream that we will have small museums like that also in other parts of the world. Undoubtedly, somebody else already has smallest museums in other parts of the world. I didn't know. I looked it up. I couldn't find it. I could find a little project, but those are museums with like small boxes in a museum that you can see always by one artist. So it's not exactly the same. But if you know about anything like that, it would be great, because I would love to visit other small museums in the world. So another thing we have right now is we have people like volunteers who come together. So this is samen lezen, or Dutch for shared reading. So after I saw during the project, the research project, what it meant for people to to read together, I definitely wanted to, set it up as a constant, something that people could ask for. And right now we have 5 volunteers. So Francine, Peter, Nicole, Annemie, and as you can see here, she's a real book doctor. And Lies, who is also a nurse at the hospital, but at a different department. And she also now is a volunteer. And they can be booked by patients if they want to, and then they come and read together in a shared reading in their room. But now I want to switch gears to the last part and show some options for my dream to have a room service for arts in the hospital. And so I wrote a book about that. It's called Kunst op voorschrift, or Art on Prescription. But in fact, I don't like the title anymore, because I think that Art on Prescription could maybe make people think that I have the audacity to know what people need from arts And that's not what I want. What I want is I want to make sure they can have it. I want to make it available. And we are now developing a digital carrier on which people can look when they are in the hospital room from their bedside. They can look and see what is possible the next week, for example. And then that can be somebody who can come and play the cello this Saturday morning at 10 a.m. Or it can be one of the readers that come and read in your room. Or it can be a artist that comes with a piece of art and talks about it, and share your what this piece of art does with you while the artist is in your room. I mean, anything can happen, and I want just to make a broad number of art sources available, and people can choose what they want at that time. So this is kind of the next level book card, and that would be the art card. So we would come by also with art, and people can put art on their walls, the art they want, or they can book through the online service. They can book a live performance of art. So this would be two separate things. And then I would just share with you some examples of what we did at our department. One of it was this piece of art. So the artist came by and said, you can rent for free my piece of art for 2 years. We put it in the corridor with a small sign besides it, that anybody who wanted it could get it in their room. It was not so successful because, of course, people just go by, they go to their room. People who visit their next of kin, they go to the room and they go in. So we always had to draw their attention towards it. So I'm still struggling a little bit on how to make visual arts available in a meaningful way. And I think that we are now collaborating also with the GUM, so the Ghent University Museum, to really work around pieces of art and around the storytelling. And then some of the volunteers and students working at the GUM, they will come like for a tour to the people's rooms with pieces of art and tell their stories. And I think that will work. But just put a piece of art in your room, it's not the same. It's a story around it. This is another project. It's called Flags for Milestones, and it's with a curator. She's called Astrid, and she was also one of my patients treated. I'm not. She knows that I talk about her, and she wants that. And she had leukemia. She underwent a transplant, but she studied history of arts, and she now collaborates with me to put art in the hospital. And this was together with Maris Camping, an artist, how should I say it? I don't know the word, but she works with tapestry artists, and they created together with 8 patients flags where the patients transform what for them are milestones that keep them fighting and you're going through the hard process. Beautiful what they made. And this is also a very special project. It's a transforming mask project. So I was asked by Kick Cancer to or stand up against cancer to do something around the year of Ensor. And Ensor is a very famous artist, a Belgian artist, and he's very famous for his masks. And that was last year. So I thought about Ensor and masks, and I thought about irradiation masks. So what you see here are 2 patients, so Maggie and Tore, and also the artist and one of the nurses of the radiotherapy. And these are their masks that they were used for irradiation. And I asked them if they wanted to co-create together with the artist and transform their masks into a piece of art. And here you can see the one from Mahi. You cannot almost recognize the mask again. It became for her, it was incredible. Also here, I can talk for hours on this project alone, but you really saw her transforming from a very modest person. Well, she's still modest, but I don't know. It's sometimes English is not my mother tongue to get the nuances of the language. But she was really yeah, she was not talking a lot, and while doing this project, she could really talk about her emotions. She could transform her emotions. You see hope. There are tears and laughter, and she was able to transform her emotions into this mask. And the other person, a totally different mask, was from Tore, a young guy, at that time 25 years old. And for him, it was really enlightening doing this project to find his place in life, because he is a young person. He has received the diagnosis of a very rare, very aggressive cancer, with the message, you will die from this disease unless we find something, a new treatment. And I really hope he got a new treatment a few months ago, that this will cure him, but we're never sure. And it was not available at the time when his diagnosis was made. So at that time, we thought we will do everything we can, but the chances that you will die from your disease are really high. So he couldn't make like long-term decisions, long-term plans. And this is, of course, crazy for somebody of 25 years old. So for him, this helped him to transform, to think about what his position in society is. Beautiful pieces of art. I was able to get him into a museum, so I really wanted to share that with you. Pieces of art that were made by patients and artists, and they were here in the Ghent Museum for Fine Arts, and they were, as you can see, centrally, it's a work from Ensor, a lady with the masks, and it was there in the museum, and we put the masks like they really were communicating with the pieces of art by Ensor they were inspired by. And wonderful news also, a scope I'm giving you. In, I think it will be 2028, there will be a new museum in Leuven, another beautiful city in Belgium. And it's called the Vesalius Museum. And they will have 2 rooms that are focused on, one on cancer and one on dementia. And in the one on cancer, the 2 masks will be part of the permanent collection. So when I received, I always, when I talk about it, I get goosebumps, because when I received that email that they were asking whether I would, but it's not my piece of art. So I contacted the patients, and because the piece of art are with them now, and they both said, yes, we want this, because it was meant so much for us, and we want to share this, what this can do. So it's co-creation art project with other people. So they will become part of a museum in 2008. These are Sounds for the Soul. These are musicians, very great musicians, that talk to people. They listen to their stories, and afterwards they create or they play a known piece of art, or they improvise a piece of music for these patients. This is Roel Diltiens, a very big, important international, but he's from Flanders, cellist, and he came to the rooms of patients. He played about 1 year ago. So I want to end with, I told you beautiful stories. I hope I inspired you. But of course, there are some obstacles. The financial support is not easy. I set up a fund at the Ghent University Hospital, but it's not easy to raise money. And of course, you need not all, because now I'm doing this alone, to coordinate it. I'm already having 1.5 full-time, being a doctor, head of department, professor, etc. I love to do it. It gives me energy. I think you might have seen it during my talk. It gives me a lot of energy, but it's not easy. It's not easy keeping on doing that. So we need personnel, dedicated personnel. I try to do it, but it's not a priority for the people running the hospital, although I think it should be a priority. It should really be a priority. Curators, because now I'm deciding who is going into the museum, who will be part of the room service. But I really would love that people who are really trained for that and professional people would do that. And I'm now talking to the Ghent, to the city of Ghent. And also you need, of course, hospital management, and also to how to involve patients, how to make them see that, because once they have experienced it, they're like, wow. But you always have to get above a certain obstacle. And now I will end. I also think we should integrate literature in the training of healthcare professionals, and it's been proven that it improves their how they can read the minds of people, and you need that to be a healthcare professional. And this is a poet that also came to read to our patients. And I want to end here because I ran 2 minutes out of time, and I really want you to be able to ask questions. So I will end here, and if there are any questions, I will answer them with happiness. And now Mira will say something.
Yes. Sorry, that took a few...
No problem. No problem.
Wow, first of all, thank you so much, Tessa, for your precious time. And having heard about your work, we understand that your time is really precious. And it's so impressive that you manage all those projects besides your normal work. So congratulations. And yes, as you were saying, we can feel your enthusiasm and your energy. That is also what people were writing in the chat. So amazing. We have a lot of questions, but a lot of them are also very specific to the projects you're running, and maybe smaller questions. So I would say we will try to send more links afterwards about the project, and people can also get in contact with you knowing that you have a lot on your plate.
I won't be able to, I get about 200 to 300 mails every day. So it's it's impossible to keep track of them, but I will do what I can. I will do my best.
Yeah, so this is also one of the things we are curious about. So you have your job, and then you're talking about the emails. And so for now, it's just you managing all those projects besides your work. How does it work also in terms of cooperations with the museums or other institutions? Are you the one who are getting in contact with them? Are they coming to you? How does that work?
I'm contacting them because I forgot to mention, like, I have lots of more projects, but I forgot to mention a very important one. I don't have picture of that and then that's why I forgot. But we, for example, have collaborations with the MSK, but now also with 3 other museums coming up to have small, and I think that's also important for this audience, to have small guided tours at the moment when the museum is closed. Because for a lot of our patients, even when they are at home, they cannot go to museum like that, because you don't know how many people are going to be there. Or will there be people who are sick and will be coughing, and I could get sick and die from an infection. So what we do now is we organize together with the museum, and I'm really grateful that they do that. It's really wonderful. For 8 patients, they can all bring somebody, so they are with 16 in total, and the guide. And for the rest, the museum is empty, and they are all patients from the hematology department, so they know about the hygiene, and then they will not come there when they are sick. For example, they will carry a mask, they will sometimes be bald, so they can just they are amongst people who have been through the same process, and that's really important, I think. And I do it. So I'm now, even then the museum asked me to be in the board of directors. Well, that sounds really big, but it's just a small group of the friends of the museum, to keep inspiring them, because for them, for the museum also, it's nice to be able to sponsor that because they pay it. So the friends of the museum, I think most museums have that kind of friends of the museum, people who pay money, and then you can do stuff for the museum, and they pay for the guided tours. So they pay the guides. Now, yeah, you talk about this, and then you get an email, or people come and say, we also have a museum. We would love to do that too. And how can we do that? And then, yeah, I do that. So, and it's, yeah, I would have been able to do much more if I would have somebody who I would still, keep inspiring and talking about it, and I love to do that. But of course, it comes in between everything else, and in this way, it's much slower than I would love to do it.
Yeah, thank you also for bringing up the obstacles. We know not only for hospitals, also for museums, it's always limited resources, financially and human resources. Yes.
Yeah.
But a lot of museums are seeking collaborations with hospitals or doctors. Do you have any advice for them how to proceed?
Yeah, I think you need to find somebody like me in the hospital. I'm sure in every hospital there's somebody, but they're not a lot. I can say that. For example, to illustrate, the guided tours. So I organized everything. I made a paper together with the museum. So all the information was on the paper, the dates, what I had to do. Very simple. Write an email, and what guided tour you want to inscribe to. So they just I sent them to mail. I printed them out. I said, just take them with your consultations, and you don't have to say anything. Just give them to the patient and say, if you want to read it, it's something special. Just like that. You don't have to, it doesn't take time. And what did I see in the beginning? Only my patients were entering the guided tours, and I could not believe that I was the only one, that only my patients were interested in guided tours in museums. I couldn't believe that. But then I saw them lying my papers, and it's not that my colleagues are not interested in art, because they go to museums, and I was like, why? Yeah, I forgot about it. Okay, I know. I also sometimes forget, but not always. So what I now do is I put them with the nurse. Every day I have consultation. But then we usually do it with several doctors together. I put them with the nurse, and when they take their parameters, like their blood pressure, and I ask them, please give also a paper. And now they are fully booked always, and I see. So it's not. And it's like, so you always need ambassadors inside. If you don't have them, it will not, and they have to be a little bit crazy like me.
So the advice would be to go out and find more Tessas out there everywhere.
Yeah.
Thank you so much.
Yeah, it's true. It's true.
Already,
you're very welcome.